Hello, and welcome to the Career Journey podcast, No Wrong Choices, where we speak with some of the world's most interesting and accomplished people to shine a light on the many different ways we can achieve success. I'm Larry Samuels, soon to be joined by Tushar Saxena and Larry Shea. Please support our show by following No Wrong Choices on your favorite podcasting platform, connecting with us on LinkedIn, Instagram, YouTube, Facebook, X, and Threads, or by visiting our website at NoWrongChoices.com. This episode is part 2 of our conversation with Dr. Brian Lima of the Vanderbilt Medical Center. Dr. Lima is a cardiac surgeon who specializes in heart transplant surgery and the author of the book, Heart to Beat. Tushar Saxena, why don't you lead us into this one?
Thank you, Larry Sam. Part 1 was all about this notion of sacrifice, which actually is, an overriding theme throughout the entire episode. But this is more about when you finally have come through that sacrifice and you've dealt with that professional burnout, and now you see your career really taking off. Because that's really what this is about. It's about once he kind of finds himself and centers himself, now we'll see where the career really takes off to. Because this is obviously, one of the top surgeons in the country, and he's found that happy balance between being a heart surgeon, which is obviously all-encompassing, and then having a life outside of that, understanding that he is not simply Brian Lima, heart transplant surgeon. There is Brian Lima, the man behind that. And even though he always will be Brian Lima, heart transplant surgeon, there has to be more to his existence than just the job.
I'm so glad you just talked about that. In addition to that, we're about to get inside a surgeon's mind when he's performing an operation. I mean, that is just amazing. What he reveals about being in the OR and how he goes about a surgery. I mean, I just find it utterly fascinating, and I think our fans are absolutely going to love it as well.
Absolutely, and we, learn a little bit more about the person and how he handles himself. He is definitely a comfortable, calm, cool, and collected individual, and that will very much come across in this conversation. So here is Dr. Brian Lima. So now you've been nurtured. You've rested,
Yes.
Your confidence is back, and you're ready to run. And, fast forward 12 to 15 years, we know that you're a heart transplant surgeon. So I imagine the path forward from there was pretty exciting. So where did you go? Where did you head? And how did you really dig into what you're doing now?
I'd always had this passion for this area of heart surgery, because I think it also translates into kind of what I do outside of being a physician, and that's kind of trying to impact public policy and kind of our system of care to improve care for these patients. But it's such an under-recognized disease, and I really felt like I could make an impact in it. So I transitioned back to Baylor Dallas, which was a high volume, center doing a lot of this. So I got a lot of repetition and exposure to it. But then I also was able to get back into writing about outcomes. And so I created databases. I was able to write about the stuff that we were doing, which was then allowed me to be at these conferences and presenting at the podium, et cetera. And then that actually led to being recruited by Northwell, which is kind of how
how we know each other.
To meet,
Yeah,
where I was basically asked, "Hey, how would you like to start the first heart transplant program on Long Island?" And I was like, "Wow, that's incredible! That's an incredible opportunity."
And how long had you been doing transplants prior to that moment?
So this was like 5 years into my career.
Got it.
5 years in practice. So this was a ultimate high risk, high reward venture, because the who's who, murderers row, whatever you want to call it, in the world of medicine and in heart transplant are in Manhattan, right? And you have the Mount Sinai's and the Columbias of the world, all these, and they were all in opposition of Long Island getting a heart transplant program.
Interesting.
They actually wrote a letter of opposition, co-signed a letter of opposition to the Department of Health, saying we do not believe a heart transplant program should be started on Long Island. And so I immediately was like, okay, great. Now all these heavy hitters.
Wow. I feel like the Godfather music just started playing again in the background.
Exactly.
Right?
It sounds like a bunch of gangsters.
they were all rooting for us to fail. So I was like, I had to really say, you know what, I can do this. We're going to build a great team. It's going to be great. The whole health system was behind it. I had to write a letter of rebuttal to this letter that they wrote. And I had to testify in the Department of Health and justify why we had.
How long was your letter? Like 2 words, like F and U?
Sounds about right.
It was just crazy. It was so crazy. But it finally came February of 2018. We finally the night came when we did the first one, and it was magical. I mean, it was incredible. It was definitely and still is like the proudest, moment of my career, because of the magnitude of that moment. So much had led up to it, and knowing what was at stake. Obviously, first and foremost, the patient, but I mean, she put her trust in us too. Like, I mean, that's also a big leap of faith to. She could have just driven, 15 miles into Manhattan and had one of these perennial kind of
Babe Ruth type of thing.
Right. So, and it went great, and it was just cameras everywhere. And one of the things that came from that night was, and what helped kind of bring everything full circle for me when I was thinking about a book and down the road or whatever, like the theme was that during that transplant, again, because of the magnitude of it, there was video and everyone was recording and all this stuff. So things that I was doing that I did second nature all of a sudden became magnified, and I took out the old heart, getting ready to sew in the new one. As I'm taking out the old heart, it's still beating in my hands,
Wow.
and it's on video, and everyone's like, whoa, the heart's still beating. And I'm like, and I pause for a moment, and it's like, yeah, it's kind of like the heart saying, wait, I can still do this. Come on, give me another shot. I was like, and it's still beating a few times spontaneously. And, took the new one, sewed it in, whatever. But that whole idea of even in its last moments, the heart still trying to go and beat became kind of the foundational theme for how I tied all these random thoughts I had for this book and tied it all together with, heart to beat and all of that. So, but it was crazy. A magical night, and a really proud moment for me.
That's so powerful. I can't wait to dig into all of the OR stuff and the surgeries. We're going to get to that. But, I can't help but think that, because you led me right into it, the egos of doctors, right? Like, you're talking about this group from Manhattan that was against you doing this. A doctor has to be very confident, like supremely confident in what they're doing. So I don't know, do you find yourself kind of riding this wave of like uber confidence, Superman kind of feeling, and humbleness to keep you grounded and make sure that you have to get that job? I just can't imagine balancing like the power that you have when somebody's in front of you on the table. I mean, that's really amazing. But then to hear these other doctors like, oh, they should come here. We're better than that guy. Who's that guy?
Yeah.
Like there's a real ego involved there.
No, I mean, one of the ways I've dealt with this is that, and it's because life sometimes has a way of reminding you just how not great you are, right? In this field. So every time, whenever I've felt really good about myself, like, oh boy, I'm look at that. I mean, I'm on a roll. This is so good. Wham. Just when you think you got it all figured out, the body, life, whatever will remind you, you do not have everything under control. And sometimes things will not go your way, even though you did everything in your mind perfect. So I've adapted to, or evolved to, you don't get too high with the highs, too lows with the lows. You just stay even keel. If something's going well, you're just cautiously optimistic. You're like, all right, I'm not going to good mouth it. I'm just gonna
Yep.
just gonna ride. And we almost, it's crazy in our field. You would, again, counterintuitive, but it's almost, we don't like it when people say, oh, the guy he's doing great. I'm like, whoa, easy. He's so far so good, doing pretty well. I'm pleased with how things are going so far, but he's not out of the hospital yet, right? So it's superstitious maybe, but I think it's when you get arrogant that you get dangerous. You got to be confident, but not arrogant. And I've learned that the hard way, or whatever, the hard way you want to call it. So
yeah,
Are transplant surgeons, the elite of the elite of the profession, and then are heart surgeons, let's say the Navy SEALs of that profession? Are you elite? Or would you consider yourselves elite athletes in that sense?
Well, I'm biased.
He's trying to stay humble.
I'm
Steve.
biased.
We were
Trying to
just
stay
talking about humble, Dusha.
I don't
blew
believe
that
it.
whole thing up.
I don't believe in humble. This man knows something that
No,
we got to
no,
get
but
this out.
actually, the Navy SEAL thing, I've used this analogy because that's what drew me to it too. When you're a little med student and I remember vividly, on my surgery rotations or whatever, and being with a 10th year resident or 10th year person, this person that has seen it all, done it all, at midnight, you're doing rounds with that person in the hospital, and there's nothing that could come through the doors of that hospital that this person would not know how to handle. Right. It's just that I was like, he's like a Navy SEAL. I want to be able to feel that comfort level because I've seen it all. I've practiced, I've trained in all these different things. So yeah, the Navy SEAL thing I think applies because outside of the brain, there's really no organ in the body by the time those 10 years are up, right, that we've not operated on, all the blood supply to everything. And I joke also about the whole saying, oh, this ain't brain surgery. I think it should be this ain't heart surgery. Heart surgery,
Right.
the heart is a moving target, the brain doesn't move, and at all 100 steps of a heart surgery, you can kill somebody, literally. I mean, step one, opening the chest. If you're a little too deep, you slice the heart, bleed out, you're dead, right? I mean, so
Wow.
all 100.
The way you say that so nonchalantly is chillingly. It's chilling.
Wow.
No, but it's so, and nothing, not to take, brain surgeons are brilliant, right? But in my mind, I feel, yes, that this is, it takes a long time because there's so much at stake and it is technically so difficult and challenging. So yeah, I like to think at least that.
Which leads me to the question that I've wanted to ask, which is the process. We're all curious to know, how do you do, not in great detail, because I imagine that would take about 7.5 hours of lecture or 10 years. What's the process? I mean, how do you identify a candidate? How do you get the heart? How does the heart get from point A to point B? Like, I guess top lining things to a certain degree, but what is the process?
So on the person needing it, they've obviously gone through the gamut of everything. They've exhausted all options, all conventional medications. So, and the heart is the analogy I use is like, you could have a perfect vehicle, truck, car, whatever, and you could do all the right things, get the oil changes, the 40,000 mile checkup, whatever. But at some point, if you drive that car long enough, it's going to give out. And same thing applies to the heart in some respects. So the only option left is replacing the heart. So there's a system in place where if we as a medical team feel that person has reached that point, we list them for a heart. And then there's a donor system, national system. And if we get a match, then we either ourselves go out and get it, or sometimes there's procurement teams that go and get the heart from the donor. That's a whole other can of worms.
Well, that's one of the questions I want to ask. Like, is the heart still beating? Is it like, what is the heart doing as it's traveling?
So there's two kinds of donors. Historically, up until 4 years ago, these were brain dead donors. So legally, someone's determined to be brain dead for whatever reason, car wreck, suicide, overdose, gunshot wound, etc. They have no brain function left. And a neurologist has to go and actually confirm that, yes, this person is brain dead. In those cases, it's a controlled donation. It's a scheduled thing. Tomorrow at 10 a.m., they're going to go to the OR. We have 5 teams coming in, one team from New York that's going to take the heart, another team from Pittsburgh that's going to take the lungs, et cetera, et cetera. And we stop the heart, take everything out, and then put the heart on ice and bring it back.
And when you say we, you are part of the team that's going to get the heart.
Or I'm with the recipient, because depending on what gets complicated is the heart really the pressure is, you really only want that process to be 4 hours if you can.
Okay.
Historically, that's kind of, so that means you have to have the heart stopped in the donor, taken out, transported, sewn in the recipient. You want that ideally under 4 hours.
Wow.
As a rough benchmark.
Wow.
So if it's if someone's not had heart surgery before, right? There's no scar, so I can get in and sew a heart in an hour on that, because there's not. But if someone has had heart surgery before, maybe they have a heart pump, whatever, it's like digging out a fossil. It's all encased in scar tissue, so it could take a good 2 hours, hour and a half to get everything cleared up, dissected out, so that you can take the heart out and put the new one in. So we have to orchestrate this dance with the donor team, our team. Okay, how long does it take to get from the airport to how long is the flight? Okay, so that means you're going to get here. We're going to be 3 hours in when you get here. Okay, that's good. That means when you get in, that means I have to have everything absolutely ready so that when you walk in the room with the new heart, boom, I can take out the old heart and sew it in. We're under the 4 hours. Now, if it's 4 hours and a half or 5, it's not. But I mean, these are just kind of like the rough guidelines we hold ourselves to. And that's kind of what it was forever until 2018, when we started to look at hearts from non-brain dead people. What does that mean? There's a large proportion of these unfortunate situations where they're not brain dead, but almost, meaning for whatever reason, they still maybe have a couple reflexes, but they're vegetables. They're in a vegetative state, and the family is still going to say, look, we're going to withdraw support. In that instance, you're saying, is it okay if we take organs after they've died? So they pull the plug, withdraw, person dies. We then come in and take the organs. That's called donation after cardiac death. The problem is the heart. How do you know it's okay after all of that? Is it's the person's been dead for a few minutes. So this whole thing now of resuscitating, bringing back to life a dead heart is what's become a big thing in our field over the last couple of years. You can either do that in the chest, where you quickly open the chest and go on the heart-lung machine and see if you can get the heart back to life, or you just take the heart out and put it on an external heart in a box.
Got it. That was going to be my question. So you keep it beating while traveling.
Yeah, and while traveling. So I did a few pioneering centers here in the United States, got going with doing that. Duke and Mass General, Vanderbilt, where I am now. And when I came back to Texas after being in New York, I did the first 5 or 6 of those in the whole state of Texas, of using these donors where the person died and we bring the heart back to life. But that's kind of the way you can use these hearts. Very, very, very big controversy right now about that in our field. It's kind of the hot button topic, if you will, in our field right now.
So if you're listening to this, you want this guy. You want this. This is the guy. This is the guy you want. I'm going to steal a question that I know that my partner here, Larry Shea, was going to ask you at some point, but it seems like the right time to ask. Teams and the team that you work with. You said yourself, you consider yourself a Navy SEAL in some ways. Is every member of your team a member of that Navy SEAL team?
This is the ultimate team sport, I have to tell you. There's so much coordination. There's so much involved. As I mentioned just briefly, you have a donor team, the recipient team, and not to mention all the care leading up to that day when, being able to take care of these people that are so sick, desperately needing a heart. They're on life support, right? So the team is massive. The team that decides, hey, this person has gotten to the point where we need to do a heart transplant. Doing the heart transplant itself, all the folks involved in the operating room to do that. There's so many people. So yeah, I would liken it to a Navy SEAL operation, I should say. A Navy SEAL operation where you have multiple members of that team with varying roles, right? But all the roles are important. It would not be possible without all of those individuals contributing. some contribute more than others. Some, have more kind of oversight than others, but still at the end of the day, it's basically a massive, Navy SEAL operation.
So every member of that team, I'm going to assume that you're not out there walking the wards anymore. I mean, you're called, and I don't mean it as a joke.
Yeah.
I don't mean it to be flip.
Sure,
I mean, like, you're not out there, walking the wards and doing rounds like everybody else. So what about the other members of your team, like the nurses on your team? Like, they're obviously very highly specialized for transplant. I'm assuming they're not out there doing the same stuff that the average nurse is doing on the rounds. They're essentially called in when you're called in. Is that the case?
Yeah, I mean, you have the operative team that are there to do the surgery. The anesthesiologists. I mean, these are heart anesthesiologists. These are top of the line, amazing anesthesiologists. You have the person running the heart-lung machine, because when you do heart surgery, you have a heart-lung machine and you have a person that's sitting there at the heart-lung machine running it. That person's amazing. Who's helping you? The nurse that's handing you the instruments, the nurse that's getting the stuff. I mean, all those things. That's just the operation part. Then afterwards, You go to the ICU and you have these nurses in the ICU that are highly specialized, and intensive care docs that are highly specialized. That, because I can't be there, right? 12 hours after all this whole thing started.
Exactly. You got to hand off to somebody who knows what they're doing, right?
They're keeping track minute to minute, hour to hour, blood loss, adrenaline medicines that need to be tweaked, all these different things. It's a whole, it's so, when you start to kind of rattle off and consider all the people involved, it's mind-boggling, but necessary for this to go well. Obviously that's what we want.
Thanks for stealing my thunder there, T. I appreciate you really stealing my questions, but it's okay. It's okay. We'll roll with it. No, but he actually led me right into what I wanted to say, which is take us more into the OR. I've had a couple surgeries myself, and, I'm laying on the table and there's some Beethoven playing and they crack a couple jokes and then I'm out. And then I don't know what happens in that room, but I'm sure, it's not what we imagine it is. So do you like music? Do you like it to be relaxing? Are you the only one speaking? Take us into the OR and really bring us through like what that moment is like. Obviously it's high pressure, but what else?
Yeah, no, I like music. It depends. I'm kind of a 90s time warp. I like 90s alternative. It's kind of,
it's not like Black Sabbath and Ozzy playing in the background.
I default to that,
A lot of Spin Doctors.
Nirvana, whatever,
Yeah, exactly.
And not specific to heart transplant. One of the unique, I guess, pressure, things that drive the pressure of a heart surgery is 99 times out of 100 for the surgeries that we do, we get to stop the heart. We go on the heart-lung machine, then we stop the heart for a period of time to do what we're going to do. You could safely stop the heart and have it come back in decent shape for a couple of hours, maybe hour and a half, 2 hours, but clearly time is of the essence. You can't be dilly-dallying. You have to be all in butt, doing what you're doing, sewing perfectly, right? Because they can't bleed to death when you're done. So there's time pressure. So when you're on clamp, so to speak, that means you have the heart stopped. It's like all attention, everything, because that's critical time. The other challenge of heart surgery as the surgeon is you have to control the whole room, all those different roles I mentioned, right? At the end of the day, I play the position of the quarterback during those operations. So I have to know everybody's job. I have to anticipate, hey, we're going to be ready to come off to reanimate the heart in 20 minutes. Can you get your this and this adrenaline medicine started? Hey, I'm going to need this and this instrument. Can we get, can we make sure that the blood products are in the room to transfuse? So it's tense, but I've seen all flavors of how a surgeon can conduct themselves in the operating room. And the ones that I've had the most respect for and been the most kind of influenced by are the ones that are the calmest, meaning that when things get pretty critical, they get even calmer. It's the ones that start screaming and yelling and throwing and this and that, and everybody gets thrown off their game. It's the ones that can take a very dire situation and kind of relax everybody and kind of be the calm, cool. And because when you get worked up, then you're not going to be as smooth either. So I try to abide by that kind of I guess persona in the operating room, is calm. I'm calm under pressure. I'm not going to fly off the handle, but you have to be stern too, right? I mean, you can't be a pushover either, because time is of the essence. You can't. So it's navigating that is an art, I think, of how to have the rest of your team function at their top, highest level of performance, but also maintain calm and be respectful too. Things that used to fly, a couple decades ago no longer fly in today's
You can't
world.
ream somebody
Sure.
out. I got you.
Changed world all over,
Yeah.
for sure. You talked about the 100 steps, right? So obviously there's a script, and you want this thing to go magically by rote. One thing, next thing, and keep going. But things happen. Things go wrong. How much of an operation is improvisation? I know we were supposed to do this, but we have to pivot here. How much is improv?
There's a thing that's evolved in what we do in all of medicine, actually in surgery, called a timeout. Before you actually start the surgery, you as a surgeon say, okay, timeout. This is so-and-so. This is the plan, what we're going to do. And I always throw in, okay, plan A is this. But if this happens, then we're going to do this. So I always go in prepared for the worst case scenario, right? So, and I have a plan. So, and that comes also with time and years. So I know exactly how I'm going to react or what the move is going to be if I run into X or Y, right? And so I prepared the team for that too. Like, we might have to do this in addition to what we're planning. So let's make sure we have such and such in the room in case we have to do that. Or this happens, there's a chance I try to statistically kind of capture what are some, possibilities, and then be prepared for them and have the rest of the team prepared for it too. Because it's unfair to just kind of keep all that to yourself too, I think. You have to let the whole team in on it. Like, when that thing happens and you're like, oh yeah, I knew this is possibly, and then you start, hey, I need this now, like blah, blah, blah. You didn't prepare the team too. That falls on you. You have to kind of quarterback and have everybody on the same page with you and be ready for those contingencies too.
As a leader, and when you describe the team dynamic, et cetera, what is the emotion and what is the camaraderie, like what happens after you've had a surgery, you've had a successful surgery? What is that feeling in the room with your team?
Like are you the type of guys that when you see someone celebrate in the end zone after a touchdown excessively, you're like, come on.
Yeah, you've been there. Haven't you been there before?
You've been there,
Yes.
like Barry Sanders handing the ball to the ref, right? Classic.
Yes.
Yep.
That's kind of what it is. Meaning, like, it's supposed to go well, right? I mean, it has to go well. Like, we shouldn't be surprised by this because we planned for it. Same way every time is kind of one of our mantras. We have this down. This is how it's supposed to go, right? And high expectations, so we don't celebrate. Also, because of that superstitious stuff I mentioned earlier, where we can't be like, oh my God, he did great. It's like, so far so good. We still haven't left the room. Got to make sure that because bleeding can also happen, right? I mean, you close the chest and we have drains in place. That there's bleeding that can happen later, so we want to be sure that's perfect. So it's still a very guarded, calm, great. We'll take the win so far, but the game isn't over yet, type of thing.
When can you take the win?
I think for me, if it goes cookie cutter by like the second day or third day,
Got it.
you will have, most of the time, if something bad were to happen, you would have seen it by then. So those first 24, 48 hours is very telling.
How important is the scorecard overall? Meaning, your surgery success percentage,
Huge.
whether that be huge. All right.
Heart surgery is all of heart surgery is under a microscope, but heart transplant in particular is under the biggest microscope because we are held to a standard of 1 year survival. Meaning, if you have a heart transplant program and your survival after 1 year is not at or around 90%, which is kind of what's considered the national average,
right,
there's a problem. Meaning, Medicare, Medicaid, CMS might come knocking on, what's going on. Like
89% means you failed?
No, success, meaning that 90% of the people you do a transplant on are still around after a year.
Right. So I'm saying, like, if your percentage is 89%,
As long as,
I mean, obviously I'm being a little facetious, but
right, I think that's the standard. But the reason why I'd say that's a problem, or it's such a challenge, is because, even if the person did great, went home, got hit by a bus 6 months later, or whatever it is. I mean, and that speaks to why our selection process has to be very, very thorough. Meaning, we're not only looking at, okay, is this person sick enough for a heart? Are they going to do well with the heart transplant? Okay, great. It's also, are they going to abide by our instructions? Who's with them at home? Who's going to help take care of them? Are they reliable enough to come in for their appointments and stuff? Because we have to make sure everything goes super, super well. It's just the high risk nature of what they have. What if the heart rejects 2 months later? We have to be doing biopsies and surveillance. So this is not all right, got your gallbladder out, good luck to you. Call if you need us. This
Right.
is a lifelong, relationship that we're establishing with this patient. So it is a very, very close knit kind of relationship that we have, and for that reason, we take it extra serious, very, very serious about who we decide is going to get a transplant.
I'm sitting here trying to process, like, emotionally, what you must have to go through. I mean, I would imagine your failures sit with you way more than your successes, of course. So I guess talk to me a little bit emotionally about, you said you took some psychology, and that is part of the training. Talking to families about complications, or, this isn't going to happen the way we thought it was, just that, letting them down, and how you compartmentalize emotionally when you have to have those difficult conversations. Are you able to just turn around and go to dinner with your friends afterwards? I mean, it's got to be very, very challenging when things don't go right.
No, I mean, that would be amongst the most challenging of everything about this way of life. I know I went on this whole tangent earlier about, my identity is not my job, this, that, and the other, but I also don't look at it as a job. It is kind of a way of life. And I get very personally attached. It's hard not to each patient. And it's a personal thing for me. If something doesn't go the way it's supposed to, or it doesn't go well, I'm very much upfront. I love to build good relationships with the patient, their family. I give them my cell phone. I go right to them. I mean, I don't hold anything back. I say, hey, look, this is what happened. I'm sorry this happened, or whatever it is. But you're absolutely right. I mean, the failures always, far fewer, but you hold on to those, and they kind of dictate how you can, you'll never forget, that one time that this happened. I think it was because, and I now, from that moment forward, I didn't do my stitch in this situation that way. I do it differently now. And right or wrong, you kind of get almost molded.
Evolve.
Yeah, you evolve, and you get molded by these events, and they're learning. You learn that way, unfortunately. And so I always say, how do we get better from that? How does that not ever happen again? Or if the same situation presents itself, what are we going to do differently this time around? So we do have those kinds of meetings, amongst us as a team, like, okay, call it a root cause analysis, or whatever kind of quality improvement. But we are like, all right, this was something we all didn't want to happen. Why did it happen? And how do we get better from it? How do we take this unfortunate tragedy and extract some morsel of positivity from it, so that we can benefit someone down the road?
You've commented, several times about not wanting things to come too close to your identity and trying to create separation, et cetera, et cetera. What is the lifestyle of a heart transplant surgeon? Meaning, we've talked to an FBI agent before, and we've asked the question, are you always carrying a gun? Are you always engaged? And the answer is yes, she is always carrying a gun. But can you shut it off? Is there space for separation for you to walk away from the job for a little while? Like, what is that dynamic?
I think the answer is yes. And I think that is also played into kind of what has led to some transitions in my career, meaning at Northwell, right? Starting the first heart transplant program for Long Island. Wow, amazing. But guess what? I was on call for 3 years.
Yeah.
Literally, right? I was the
Right.
only person doing them, right? So in our program. So yeah, I could maybe escape for a weekend to the Hamptons, but be able to drive back if a heart transplant surfaces or something.
Yeah.
That is not sustainable, right? So at a place like Vanderbilt, where we do more heart transplants than anyone on the planet, we have a big team. And so we can kind of take a little time,
Right.
a weekend here or a week there. So we can be human, so to speak. You can take that time to do other,
And
take
recharge.
vacation like a norm and recharge and stuff like that. So that is important. And on a day-to-day basis, when you're in the throes of kind of this, especially at a busy place like this, it's not that you can't turn it off, but you're not surprised if you get a call, because, and that was a decision. I chose to come to a place like this because I don't know. I've kind of almost come full circle. I want to be in the throes of the mecca of, doing as much of this as possible. So if one of my colleagues is in trouble and needs help, even if it's not my day on call or whatever, I'm going to come in and help them. Or
Oh, you learned that from your boys in Texas.
yeah, or whatever it is. Hey, we have 2 transplants going at the same time. Are you available? Yeah, I'll come in.
Yeah.
Do whatever it takes. So, it sort of, it depends on the day. I'm trying to be more on living in the present. I think that was also a big departure. I was always wired future, future, future. I got to do this to get to this so that I can achieve this and get to. Now I think it's more about living in the present, enjoying the current moment. I'm getting to talk to you guys and having a good time, and this is pretty neat, right? Not constantly thinking about, okay, yeah, so I got to do this so that then I can ride the ladder and ascend to this other thing. It's no, tomorrow is not promised. You got to make the most of today, and that's something that is new for me. I would say in the last few years that I've evolved to that. That was more of a maturity thing, and not constantly being overcome with how do I continue down this rabbit hole or on this hamster wheel.
Was that some of the impetus behind writing your book, Heart to Beat?
It was such a cathartic thing to do it, and I had no reason. I still do not understand why I accumulated all these random thoughts or observations, and it finally came to a point where I was like,
You've been doing this stuff a long time.
Yeah.
What else are you going to do?
I got to get this out on. I think it can help people. I don't know. I read David Goggins' book, Can't Hurt Me, and that was really impactful for me. And I felt like I could tell a somewhat similar, analogous story, but from my perspective and through what I went through. And I don't know. I felt like maybe some learning lessons that I experienced along the way could help other people, because I don't have it figured out. I haven't yet figured it out, and I thought, and I think most of us do when we're young. We're like, all right, once I get to this, I'm going to get my MBA, and then I'm set. You're never set.
Smooth sailing, right?
You're never set. It's like that's the biggest fallacy, I think, of being young and thinking I achieved this goal and I'm done. You're never done, right?
Yeah.
We're always learning, we're always improving continuously. So that's kind of how things have gotten there.
Do you still, I mean, I think you like the job that you do, but let's say the industry as a whole, medicine as a whole. Are you still happy with medicine overall? The way things are?
No. Meaning that's kind of also why on the side here, I've about to get my MBA. I'm like one class away. And partly was because when you're in the midst of training to do whatever your craft is going to be, you have no idea about this other whole world that exists outside of what you're doing in the operating room. It's the business of medicine, right? How do hospitals run? How are things paid for? Who pays for it? All access to care, all these different things. And that really hit home when I finally got out into the real, market and was just kind of viewed as another commodity and all that stuff. And I was like, I don't know any of this stuff. I don't, And so that's what drove me to say, I if I'm going to make a difference in healthcare in general, or whatever segment of healthcare that I'm really interested in, I need to bone up. I need to understand these things. I need to.
Right.
So that's what led me to pursue this MBA, just because I want to be able to talk at the same level with the C-suite people and understand what they're talking about and know kind of what drives them. Right. It's not as simple, unfortunately, from my perspective, as taking good care of patients. Right. It's much, much, much more than that. It's not so simple. So I want to understand it to be able to help improve it.
Are you the world's best player at operation, at the game operation?
I haven't tried it. It'd be interesting to see how I would. I haven't tried it in a long time.
Get out of here! You haven't tried it. Come on.
It's been some time, but I'd be totally game to try.
That is very funny. My son just got the game Operation as a gift. He's 5, and it just so happens my wife is a surgeon, so we have a ringer in the house. It's very funny. I will not play with her.
What is your favorite medical show? Do you have one?
Oh, medical show. I actually hate all the medical shows for the most part.
Oh, come on. Why does everyone hate? Why do you guys all hate medical shows? Does no one have?
Because it's fake.
I like Scrubs because it makes fun of itself.
There you go. Now you're talking. Now you're talking.
Yeah. No, the movie Malice with Alec Baldwin.
Oh, that's very funny.
You want to know something? Here, funny thing.
Talking about
Before we started this interview, this is exactly what I was talking about with these guys. I was like, you know what? I'm going to ask him about this movie, Malice. And does he think of himself as Alec Baldwin when he says, you know who they're praying to when they're praying to God? They're praying to me.
I thought that was very impactful, actually. I kind of already made up my mind, but I was like, wow, he's obviously taking it a little too far. But I was like, wow, he's pretty cool. It's pretty intense, though. But I love that movie. I think it's pretty... it's well done.
I'm glad you said that. I'm so glad you said
that. Is great.
Sure asked both of us if we'd seen
we just
the
talked
movie,
about it.
and we knew the title. We'd never seen the movie.
Oh, there's this. You gotta watch it. It's crazy.
Oh, watch this movie. Yeah. Watch this movie.
Okay, so have you ever been, let's say, at a restaurant or on a plane, and you've heard the words, "Is there a doctor in the house?" What do you do in that instance? You have to respond, do you not?
Yeah, I believe you do, but never on a plane. I think I was in a restaurant in Manhasset one time when someone was choking on food or something, or having a seizure. I can't remember, but it just so happened it was like a convention of ENT docs, and
12 hands went up,
and they were at that. I think like the next table over, and it was like there wasn't even like a need. It was like 17 doctors descended on this.
Oh, that's
guy,
great.
Like, in a matter of
that's great.
Luckiest
I was
person
like 3
ever.
rows back. Yeah.
I wonder how
Comparing high no, do it this way. No, you're doing it wrong, Bob.
So, Brian, at this point in the conversation, we always ask our guests to impart some wisdom and some advice to people who might want to follow in your footsteps. I imagine if we get 1 million listeners to this podcast, one of them will want to follow in your footsteps. So, somebody who wants to get into your profession, somebody who wants to get into medicine today, what type of advice do you have for them?
I would say I love what I do, and I would recommend it 1 million times over. You just have to want it for the right reasons, and if you want to do it, you can do it. You'll have to work hard and never settle for complacency. There's always room for improvement. You just have to, you can get there. If other people could do it, you could do it too. You have to believe in yourself, but it takes time and practice and humility to do it, but you could do it.
Incredible advice. Well, Brian, thank you so much for the time today. Everybody out there, the book Heart to Beat, you're going to want to look for that. Brian, I imagine it's available everywhere books are found?
Yes. Amazon in particular. Yeah.
Is it on audiobook?
No, didn't have the time to do it, man.
So not everywhere.
Yeah, you should narrate it. Come on.
You had to blow it up
maybe,
too, Sean.
You need to hire a VO guy to just get that done for you.
2024. Yeah, maybe.
That's next project.
Yeah.
So, Brian,
Right.
thank you. This has been a remarkable conversation. So interesting. You've opened our eyes to so many different things that we've really never thought about before. So, Brian, thank you so much for joining us today.
It's been a pleasure, guys. Thank you. I've had a blast.
So that marks the conclusion of our conversation with Dr. Brian Lima, and my expectations were incredibly high going into that, and I can honestly say that they were met. Larry Shea, what are some of your thoughts?
That if I have to be on a slab and have somebody open me up, I would like it to be this guy. Pretty much. I mean, how powerful was the moment when he talked about opening up the chest and like taking the heart out and it was still beating? I mean, amazing. I mean, what a phenomenal interview. But I mean, my biggest takeaways, I mean, let's think about it in terms of our professional lives and our career paths. He talked about love what you do. You have to want it for the right reasons. I think those are such valuable lessons that we sometimes lose sight of. And he also talked about never settling and believing in yourself. This is a very big challenge to do this kind of work. And, I consider myself very accomplished professionally, but the amount of information that he had to get under his belt and to know like the back of his hand and just like, I don't know. I couldn't imagine an endeavor such as this and accomplishing it. And he's an amazing guy, and just really impressive to hear him talk about all of this, because I don't think it's something that anybody could just do. I think you got to kind of be built for this.
I think you're probably right about that. I will say this. Knowing that every time he learns one new thing, something else leaves him.
That was great.
I do wonder when it is you forget how to make a sandwich. Like walking to the kitchen one day. Well, what is this bread I'm using? No, that's one thing. But you weren't just you're saying the correct thing there, Larry, and that and we'll say it again. The sacrifice that it takes to reach the heights of this profession, they are extreme. But the other piece of advice that he had, which I thought was so telling, was, it's okay to take an unconventional approach to your career, right? If you feel that being in public practice is burning you out, well, then maybe it's okay to go into private practice and have actual real hours that you deal with and have actual real and try to have an actual real life. This is not a bad thing. And, obviously this is not 20, 30 years ago where it was more like being in the Marines, where now you actually, you can have something more of a life, but he has found that proper balance to it. And I will say this, I always thought of doctors at that level as elite athletes. He's correct. They're more like Navy SEALs because of that kind of precision, that kind of planning that goes for. They literally are trying to storm beaches every time they have an operation like this. They are literally doing a real kind of pseudo-military operation when they're heading into the OR. Everything has to be planned out precisely. Everyone has to know their job, and everyone has to know everyone else's job as well. It's amazing.
Absolutely. As I look back on the conversation, and you guys have wrapped things up extremely well, I'm just going to sort of grab at a few strings or straws here. One of the things that I found so compelling was when he came to New York and when he came to Northwell on Long Island, and some of the challenges that he had to deal with setting up a practice in this area. We're all in New York, I should say that, for heart transplants. He was the guy. He was the first one out there. I mean, he was a pioneer for this region, which has to be thrilling. It has to be scary and a whole bunch of other things. And then add on top of that the dynamics and the politics of New York City. It really showed me a lot about him in terms of his mettle. It's not just the fear and the challenge of taking on this massive endeavor. You have to have the politician in you to work your way through all of this other stuff, and that takes a very special kind of person. So, Dr. Brian Lima, thank you so much for joining this episode of No Wrong Choices. And I should point out, for anybody who wants to get his book, Heart to Beat, it is available everywhere. We also thank you for joining us. If this episode made you think of an inspiring person in your life who could be a great guest, please send us a note via the contact page of our website at NoWrongChoices.com. We also encourage you to connect with us on LinkedIn, Instagram, YouTube, Facebook, X, and Threads. On behalf of Tushar Saxena, Larry Shea, and me, Larry Samuels, thank you again. And always remember, there are no wrong choices on the road to success, only opportunities, because we learn from every experience.